Guess what? One of the oldest recorded diseases in human history has a kill count in the millions. To this day, it continues to take nearly 59,000 victims every year worldwide. It inspired folklore. It shaped medical science. It has a survival rate that changes completely depending on when you act. Before symptoms, you almost always live. After symptoms, almost no one does. For thousands of years, it turned small animal bites into death sentences. It helped push humanity to develop one of the first successful vaccines. And once it reaches your brain, you're about to take a forever nap. Today, we're talking about rabies. This is Guess What?, where curiosity might just bite back, and timing is the only difference between survival and silence. Rabies is caused by the rabies virus, a member of the lysovirus genus. It enters the human body through infected saliva, most often delivered through a bite where saliva is pushed deep into muscle tissue. The bite isn't the real weapon, the saliva is. As it gains entry, it attacks the nervous system, not the lungs, not the gut, the brain. Once it reaches your brain, it causes encephalitis, inflammation of the brain itself. And here's what makes it terrifying. Once symptoms begin, survival is extraordinarily rare. Before modern medicine, rabies was effectively 100% fatal after symptom onset. Even today, globally, survival after symptoms is almost unheard of. But here's the twist: rabies doesn't rush. After a bite, the virus can incubate silently for weeks, sometimes months, occasionally over a year. It travels along peripheral nerves toward the central nervous system at roughly 12 to 24 millimeters per day. That means distance matters. A bite on the face? Faster. A bite on the ankle? Slower. It's literally crawling toward your brain. Rabies has two primary clinical forms: furious rabies and paralytic rabies. Furious rabies is the one that fueled medieval nightmares. Agitation, confusion, hallucinations, hypersalivation, and hydrophobia, fear of water. But here's the clarification: it's not psychological fear, it's muscle spasms. When someone with rabies tries to swallow water, the throat muscles spasm violently. The body associates water with pain, so the patient becomes terrified of drinking, not because of madness, because swallowing triggers agony. Paralytic rabies is quieter. It causes muscle weakness and paralysis that gradually spreads. Either way, once neurological symptoms appear, the disease is almost always fatal without early treatment. Rabies is one of the oldest clearly documented viral diseases known to humanity, with written descriptions going back nearly 4,000 years. Around 1930 BC, Mesopotamian legal texts, the Code of Eshnunna, described fines for owners of dogs that went mad and bit people who later died. That's one of the earliest known written references to a specific infectious disease with recognizable symptoms. In 400 BC, Aristotle wrote about dogs suffering from madness and transmitting disease through bites. The link between saliva and transmission was already being observed. Centuries later, the Romans gave the disease the name we still use today: rabies, from the Latin root rabere, meaning to rage, or to be mad. Across Europe in the Middle Ages, rabies outbreaks in wolves and dogs fueled folklore about werewolves and possession. A person bitten by a wolf who later developed aggression, confusion, and uncontrollable behavior? In a pre-scientific world, that wasn't neurology. That was mythology being born. In 1885 AD, a 9-year-old boy named Joseph Meister was bitten multiple times by a rabid dog. His mother brought him to a chemist, not a physician, named Louis Pasteur. Pasteur had been experimenting with weakened rabies virus in animals. He had never tried it on a human. If the boy died from the vaccine, Pasteur could be ruined, professionally and legally. But without intervention, the boy would almost certainly die anyway. Pasteur administered a series of injections using attenuated virus from infected rabbit spinal cords. Joseph Meister survived. That moment marked the first successful rabies vaccination in a human. It wasn't just a victory over rabies, it was proof that vaccines could prevent viral disease after exposure. That concept, post-exposure vaccination, was revolutionary. Most viruses infect cells, replicate, spread through blood or airways. Rabies does something more precise. It binds to receptors at neuromuscular junctions, where nerves meet muscle, and hijacks the nervous system as a highway. It avoids triggering a massive immune response early on. It travels stealthily inside nerve tissue. By the time the immune system fully recognizes the threat, the virus is already inside the brain. And here's the key. Rabies is preventable, even after exposure, if treated before symptoms. Modern treatment includes immediate wound washing with soap and water, rabies immune globulin injected around the wound, a series of rabies vaccine doses over 2 weeks. If given promptly, this post-exposure prophylaxis is extremely effective. But once symptoms start, there is no reliably proven cure. A small number of patients have survived using aggressive experimental protocols, such as the Milwaukee Protocol developed in 2004 at the Children's Hospital of Wisconsin. Doctors placed a teenage patient who became symptomatic after being bitten by a bat into a medically induced coma, hoping to protect her brain while her immune system produced antibodies against the virus. Remarkably, she survived, the first known unvaccinated person to do so after symptom onset. But repeated attempts to replicate the protocol have rarely succeeded, and it remains controversial. Survival after symptomatic rabies is still extraordinarily rare. Globally, rabies still kills about 59,000 people each year, primarily in Asia and Africa. The vast majority of human cases worldwide come from dog bites in regions where canine vaccination rates are low. In the United States, widespread dog vaccination programs have drastically reduced domestic dog transmission. Today, most human rabies cases in the U.S. are linked to wildlife exposure, particularly bats. Not wolves, not stray medieval dogs, bats. And sometimes, the bite isn't obvious. That's why public health guidance often recommends evaluation if someone wakes up in a room with a bat and cannot rule out contact. Because once symptoms begin, it's too late. Rabies is terrifying, but panic is not protocol. So let's draw the line clearly. You should seek medical evaluation immediately if you are bitten or scratched by a wild mammal, particularly a bat, raccoon, fox, or skunk, or by an unfamiliar or unvaccinated dog or cat. You wake up in a room with a bat and cannot confidently rule out contact. Saliva from a potentially rabid animal enters an open wound or your eyes, nose, or mouth. Here's the key principle. Rabies exposure is about saliva plus broken skin or mucous membranes. Petting a dog? Not exposure. Seeing a raccoon? Not exposure. Walking past a bat? Not exposure. A bite, scratch, or saliva contact with broken skin? That's when you don't wait. Because remember, the virus travels slowly. But once symptoms begin, options collapse. If you walk into an emergency department with a suspected rabies exposure, here's what happens. First, they clean the wound. Thoroughly. Soap and water alone significantly reduce viral load at the site. Mechanical washing matters. Then comes post-exposure prophylaxis. If you have never been vaccinated for rabies before, treatment includes two things: rabies immune globulin, rabies vaccine. The immune globulin contains ready-made antibodies. It's injected directly into and around the wound when possible. Think of it as immediate, temporary protection. It neutralizes virus locally before your body has time to respond. Then you receive the vaccine series, typically 4 doses over about 2 weeks. Day 0, Day 3, Day 7, Day 14. That's it. If you were previously vaccinated, you do not receive immune globulin. You receive fewer vaccine doses, usually 2. That's the entire strategy. Neutralize locally. Train the immune system. Beat the virus to the brain. And when given promptly, it works extraordinarily well. Rabies holds a strange place in public imagination. It's rare in developed countries. It's preventable. And yet, it's one of the few infectious diseases where the phrase, almost universally fatal after symptoms, still applies. That changes how people think about it. Rabies isn't frightening because it spreads easily like influenza. It's frightening because it gives you a window, a silent countdown. And whether you survive depends entirely on whether you act before you feel sick, which people rarely do. That's medically unusual and psychologically brutal. Rabies is ancient. It shaped folklore. It shaped vaccine science. It shaped modern public health policy. It forced humanity to confront something uncomfortable, a disease that doesn't give second chances. And yet, it's preventable. Rabies is a paradox, one of the deadliest viruses known to humans, and one of the most controllable, if we act in time. That's today's episode of Guess What? If you enjoyed walking carefully through history with me, hit subscribe, because next time, who knows what we'll uncover. Until then, stay curious. And remember, this is definitely not one of those times to be anti-vax. Hola.